Good evening, everyone, and welcome to my show, Autumn is Here. My name is Francine Crawford, and I'm your host. Today, we have a palliative care doctor who's going to talk to us about that service. So let's welcome today Dr. Tartania Brown. Welcome to our show.
Hello. Thank you for having me. Hello, listeners.
Thank you for being here. First, let's just start with just tell us a little bit about what you do and how long you've been doing it.
Sure. So I am Tartania Brown. I am a senior palliative care physician with MJHS, which is a non-for-profit hospice and palliative care organization here in New York City.
Oh, okay.
One of the largest.
Okay. And how long have you been doing it?
I've been working for 8 years in palliative care. Yeah.
Okay. And what made you do this? What made you go into palliative care?
So a lot of reasons made me choose palliative care, kind of like my background and upbringing. And really, I just wasn't scared to have very deep conversations. Actually, I was in training because my thought process was I was going to go to be a hematology oncology specialist. And I didn't even really know the term palliative care, but I was in training and my co-intern in residency was very scared of a person who was sick and not doing well. And we had to have heavy conversations about what are you expecting at this stage of your life and what would you like to happen to you and to your family going forward? Are, aggressive medical measures appropriate at this stage? And I dove into those questions very willingly, where I know someone else might shirk away and be scared of that.
Yeah.
And I was comfortable having those conversations. So it was a senior resident who said to me, "You should do palliative care." And I said, "Palli what?" I didn't even know the term. So he explained to me what it was. And I thought it was amazing. I did a few rotations in it. I fell in love with it. I had to give up hematology oncology, although I love blood and cancer and like helping those kind of patients. I get to help them in a different way through palliative care.
Right. Oh, that is awesome. That's awesome. Okay. So can you just explain to the audience what exactly is palliative care?
Sure. Palliative care is a medical specialty similar to neurology or cardiology. But the unique thing about us is that we use a multidisciplinary team to address not only physical pain, but also social, psychological, and emotional needs of the patient. Really a holistic type care for the person from a medical slant.
Really? Okay. So it's medical and non-medical.
Well, it's medical. Yes. Let's say all that. Medical, and non-medical is if you're defining social care, psychological care, emotional care, using medications, pharmaceuticals, as well as sometimes, encouraging mindful meditation, because you have to address pain in all sorts of ways, even spiritual. We encourage chaplaincy and to work with patients as well.
Oh, wow. Okay. That's good to know. Okay. So what condition do you have to be in to receive this care or to need this care?
So many persons with that get referred to palliative care have multiple medical problems or they have advanced illness. So an example would be a person with cancer that's spread, but also is having pain, whether it be physical in their body or maybe emotional pain and psychological pain. That person can be seen by palliative care because we can address their pain management in their body, as well as the emotional and psychological or spiritual pain that they might be facing. Another type of patient would be like a heart failure patient who's quite short of breath, especially when they're walking from point 1 to point 2. We can really address that shortness of breath symptom and also talk to them about what else are they feeling and how are they coping as their body is changing. And the third type of example is really any disease that's more end stage or that's progressed. And I say that because as a disease progresses, there are less treatments available and there tends to be more symptoms that develop and occur. And by having these more symptoms that develop and occur, we can intervene and help, whether they be physical symptoms or emotional symptoms.
Okay. Wow, that's interesting. I'm learning a lot. Well, as you know, my podcast is Autumn is Here, and it's about changing and getting older and senior living and having to assist other people and helping them to get through maybe an illness or a change in their life as they grow older, or even for yourself, to recognize that you have these resources out there, So I know that we talk about hospice, but what's the difference between palliative care and hospice?
Okay, we're getting into the realness now. So hospice has two main things that I would say. I would say a person who's who's choosing a hospice is really deciding that they no longer want aggressive measures, or they can no longer receive aggressive measures and therapy, such as they're too weak or too sick to really receive things like chemotherapy. Also, those patients would require two physicians to say, yes, they have approximately 6 months or less of life expectancy to live. Mm-hmm. So those two things are really what determines hospice care. Whereas in palliative care, you can continue to receive curative therapy, such as the same chemotherapy.
Okay, so you can, if you have an illness that's debilitating or something like that, and it's not necessarily that you're going to die, soon or anything like that. It could be that it's terminal. It's not something that can be cured or something like that.
Right.
Is that something that would qualify you for palliative care?
Absolutely, yes. Okay. So it would be something that's terminal, but you're not at the end stage yet, and you can still receive some treatments, but maybe you just have a lot of symptoms and the illness is really causing a lot of fatigue or pain or shortness of breath or emotional distress or spiritual distress. Palliative care can really come and help in that realm. Yes. And then we even have very deep conversations, because as the person continues to decline, we can even talk to them about hospice services and maybe even say, at this stage, you might be eligible or qualify for hospice at that point. So we're not hospice, but we can work with hospice. We can talk to patients about it if need be.
Okay. So MJHS can be a link to getting them the hospice care that they need.
That they absolutely need. Yes.
Okay.
And I love that. We can work together.
Right. And any disease.
Yes.
Any illness.
Mm-hmm. Okay. Any illness. Yeah. That's more later stages with multiple with significant medical health burdens.
I really appreciate that, because sometimes we don't know things other people know and we just don't know.
Yeah. I think that's really what it is, and medicine, we have this idea of what it looks like, and we don't always know that these other parts exist. I do have to say that people are finally starting to learn about palliative care. So I actually saw on Grey's Anatomy, on a more recent Grey's Anatomy, it took like what are they on, season 1,000? Exactly. I don't know. But finally, in their last season, they're finally bringing up this word, palliative care. And I saw it twice in 2 different episodes. And I was like, wow. Finally. Right. So my specialty is being talked about, even in Grey's Anatomy. It does exist. So I'm very happy to know that people are getting the word out about palliative care services and also hospice care services. I think. Is there a shortage?
Is there a shortage of palliative care?
We're a small group. Yes, it is true. We're a small but mighty group, but we're growing. It's not that there's a shortage. It's that there was just not enough people knowing about the specialty, right? Even myself, I was initially thinking to be an oncology doctor. And it wasn't until someone who suggested I be a palliative care doctor that I even looked into what that was. So through mediums like this, through mediums like television, through all these other sources, we get to inform students and trainees that palliative care exists, and that the more they know about it, the more they're willing to come into the world of palliative care. So it's a shortage, but it's because it's just not enough people knowing about palliative care.
Is it something that you find in your experience that people know about and ask for, or is a doctor has to, refer them to it, or, because I didn't know at all when my mom was ill. I had no idea. And it was up until the time when I had to make a decision on her getting a feeding tube. And
wow.
when my response to that was, of course, I want her to eat, and the nurses that were there, she was in a nursing home for quite some time. And some of the nurses would come up to me and it's like, well, it's your choice. And I was wondering why, I was confused because why are you asking me, do I want my mother to be fed, and then they kept explaining to me the nursing home apparently wanted me to get one. And some of the nurses who knew me for a while talked to me and said, it's your choice and you don't have to. And then I agonized over this for about 3 weeks. And then the doctor at the hospital, when they sent my mom back to the hospital, she said they got me in touch with a palliative care doctor, which I had no idea existed. And she explained to me how the body is different now, and food is something different to the body. It's not just eating food, and it's, you get nutrition that keeps them alive, but they don't hunger like normal people do. Mm-hmm. So when she explained that to me, I opted not to get the feeding tube. Plus, they said the nurses had told me sometimes you might get an infection in the feeding tube. So I didn't want my mom to be in any pain. So that's why I opted out to. But some people don't know. I didn't know. I never heard of it before. So how do people know to ask? Or it has to be from a doctor?
So I think the wonderful work that you're doing right here on this podcast is definitely helping to get the word out. So palliative care is a specialty service like any other specialty service, but you're right. Not enough of people know about it. So you still would need to be referred the same way that anyone would need to be referred, like a cardiology or a neurology appointment. You would need a referral to the specialist of palliative care. But the good thing is that anybody on the medical team can refer. So that means any patient or family that's aware of palliative care or just wants to have more information about palliative care can talk to someone on the medical team and say, hey, can you put a palliative care referral in? And then we will come on board and we will do exactly what you just had, those wonderful conversations about where is mom now? What is the body like at this stage? Can she really tolerate the feeding, or is the body too weak to tolerate the feeding? And it doesn't need all those calories the way that you and I do, as we are able to use that energy and walk around. Someone who's in bed and not moving much, they have different requirements and the hungers are different. Right. So palliative care can have those very challenging conversations and have it very open and honest. Like I'm comfortable talking about it, as are the people that I work with, all the different disciplines I work with.
Okay. Well, is it covered by insurance, regular insurance, or is it something special that people should, think about to get, extra?
It's just like any other insurance, any other specialty that requires insurance coverage. So once you go to, say I keep using cardiology as an example, but let's say neurology, let's say eye doctor, you need to have insurance for the coverage. It's the same thing for palliative care. You just need the insurance, and you can talk to social workers to help you with getting insurance if you need insurance.
So what is the training like? Since this is new to me, and I'm assuming it's new to other people. What is the training like being able to get into this as a specialty? Seems like there's some specific training that you might need to have.
Oh, yes. So not only do you do your 4 years of medical school, and then your 3 to 4 years of after medical school, which is called residency. Then after that, you do another 1 to 2 years of specialty in hospice and palliative care. So for me, I did my 4 years of medical school. I did 3 years of residency. I did an extra year of chief residency. And then I did 2 years of Hospice and Palliative Care Fellowship. So yes, we do get a lot of training. We are in school for quite some time, but when we come out, we don't mind talking and having these conversations with people and always being a champion on palliative care. I love that you brought it. You want to have it on your network, and your listeners are understanding this world of palliative, because the more we hear about it, the more we know about it, and the better care people can get. Pain management can get better. Emotional distress can be addressed. So let's get the word out there on palliative care.
Yes, absolutely. And that's one of the things with my show, trying to be prepared and have the information so you know what to ask for, and medically, some people may not even be able to afford some medicines. It's medical, medicines are expensive. And I was thinking when you were talking that, maybe there's some ways and suggestions if they have palliative care that can help them alleviate some of the pain. Even if they could not afford some of the medications. So,
correct. That's absolutely true. We are always thinking about how to give the best care in whatever setting it is. So if you don't have a lot of funds, then we will definitely work to figure out, well, what medications can work for you with the limited funding that you have? What services can you receive in the setting that you're in? So it's always thinking about that in our conversations. Absolutely.
Great. So is there anything else that you would like people to know about palliative care, or is there something that you think is important or overlooked that maybe, this information will help somebody?
Absolutely. I think I want people to know that palliative care is an amazing field. It can be delivered wherever the patient is. So telemedicine is a great venue and a hot button venue for palliative care. It's also known as video visits is the other word that people know it more to be. So video visits the person can be at home. So palliative care can be delivered to patients' homes. It can be in hospitals. It can be in nursing homes. It can be in assisted living facilities. So you can have palliative care specialists and receive palliative care services in all different venues. And this great tool of telemedicine helps broaden our expanse.
Oh, that's great. Oh, wow. So I'm so grateful that you were able to be here and just give us some information on this. And I hope that people can take this and consider this, in their treatment.
I hope so.
Yeah. And even if caregivers are listening, maybe there's something that you've observed with the person that you care for that maybe you can introduce, that this is another way that maybe they can get extra help, or, just ease them medically or physically or whatever they're dealing with. So it's really interesting. And it seems like so many ways that it can help people.
Definitely.
Yeah. So I wish I knew about it, earlier, than when I had to make a decision. But it seems amazing that you're able to do this. And thank you for doing this, because it's a caring thing. We know that doctors care in general, but this is something really caring. And one of the things I would like to talk about, and one of the things I've always said, was that we have to ask the hard questions, to our parents, to our loved ones. Ask the hard questions. Sometimes it's hard to ask these questions, and your job is getting into that and asking the hard questions, because it's necessary for their care and their health. So, I'm just so grateful that you took the time. And, if there's anything else you want to say.
I want people to know that we are always here for you. And we love talking to not just patients, but to their families. We love having family meetings. So family meetings can have the main doctor there. It can have the specialty doctors there. It can have a number of different family members, because maybe you're thinking one way, but your siblings are thinking another way, or your cousin who's in Florida is thinking a third way. And we can bring them into the conversation via telemedicine and via the phone. To really talk about the loved one and include the loved one, the patient, into these conversations. Let's put it all out on the table. What is everyone's view? What are you understanding is going on at this stage? And how can we help bridge the gaps of knowledge that different people are having? I like to say that with each different member on the team, they help bring a different part of palliative care. So in that family meeting, not only would I be the medical personnel be there, but you could have a social worker be a part of it. And they bring a different type of palliative care and information. Or a chaplain could be there and they can bring a different part of palliative care and information. So the different players all are here to help the loved one, the patient, family members understand where we're at and how do we move forward. I'm sorry you didn't get to learn about palliative care before, but the wonderful thing that you're doing is everyone who's hearing this now knows about the world called palliative care and why I love it so much.
I love that it's all inclusive, though, that every aspect, people can come in, a chaplain can come in, a social worker can, talk about it and get help. So this is great. This is great. I thank you so much, Dr. Brown. I appreciate it. And I thank MJHS for allowing you to do this and get the information out. And if they go to their website, will they be able to find more information on palliative care?
Absolutely. MJHS.org. You can learn about hospice services, but you really can learn about palliative care services and know that we are different, but we can work together.
Oh, okay. Okay. Well, thank you again. I appreciate your time. Thank you again. This is another segment of Autumn is Here, and I am so grateful that you're here. Thank you, Dr. Brown, and hopefully we'll get a chance to talk again.
Sounds good. Hope so.
Okay. Good night.
Take care.
All right.